very good morning everyone. So today's lecture is on principles of tooth preparation. By the end of the lecture you should be able to understand how to evaluate an abutment tooth, then what are the basic principles of tooth preparation, then what are finish lines, their advantages, disadvantages, the indications, contraindications, and in what kind of restorations they are applicable. And also you must identify the factors influencing the retention and resistance of a cemented restoration. So to start off with, fundamentals of tooth preparation according to Rosenstiel et al. Is to achieve an optimal restoration, keeping in mind the biological considerations, mechanical considerations and aesthetic considerations. And whereas Schillingberg said that preservation of tooth structure, retention and resistance, structural durability, marginal integrity and preservation of periodontium is important for tooth preparation. So what are the 5 basic principles of tooth preparation? Preservation of tooth structure, then retention and resistance form, structural durability, marginal integrity and preservation of periodontium. So these are the 5 most important principles that you need to keep in mind when you are preparing a tooth for receiving a crown or a restoration. So in detail, let us look at what is preservation of tooth structure. So while you are trying to preserve tooth structure, you know that once a tooth has been destroyed because of caries or because of fracture, there are many ways that you can use to restore the tooth to its normal anatomy and form. Either you can do a partial veneer crown or a full veneer crown. So in my last lecture I was explaining to you, I was showing you different pictures of how an onlay looks like, how an inlay looks like, right? So you know what is the difference between a full veneer crown and a partial veneer crown. So the intention why you are using different kinds of crowns is that so you're trying not to sacrifice a lot of tooth structure so that because the more you try to remove enamel or the more you're going deeper, what happens is you are compromising on the core of the tooth structure. So hence the tooth structure is weakened and the crown that you're going to give, the restoration that you're going to place over the prepared tooth will be a compromised restoration and it can lead to a failure. It can be fractured because of the occlusal forces and it will not be a successful restoration. So that is where you need to decide which type of crown is required, and based on the clinical appearance, the condition of each tooth, you will have to take a call. And the next thing is that the type of finish line that you would give, whether you would give a supragingival margin or a subgingival margin. So let's see what is the difference. So in anterior restorations till your first premolar, the thing is you need to understand that there's something called as the emergence profile. When you try to give equigingival margin or a subgingival margin, your restoration looks more aesthetic and it appears as if it is emerging from the socket. But whereas if you try to give a supragingival margin and if you are doing a porcelain fused metal kind of a restoration, what happens is the demarcation between your finish line and your unprepared tooth structure, that is the demarcation between your crown and the unprepared tooth structure, will be very clear and it will eventually lead to formation of a black line differentiating the two surfaces, and hence it looks very unaesthetic. So you must take a call that in anterior restorations you can give a equigingival or a subgingival finish line, but whereas in posteriors where aesthetics is not a prime concern, supragingival margins can be given. So why do we preserve the tooth structure? Why do we need to preserve the tooth structure? You are avoiding reduction of all the surfaces of the tooth, as I mentioned earlier. Then you are also avoiding excessive occlusal reduction to achieve a correct occlusal planar, because your crown has to be in the in line with the existing occlusion of the patient, and at the same time you should also avoid giving a flat occlusal surface. So whatever tooth preparations you are going to do, it should follow the anatomy of the existing tooth, like how the natural tooth was earlier before you begin the preparation. Then you have to reduce based on the requirement of the restoration. You should not unnecessarily remove excess tooth structure, hence leading to weakening of the tooth structure. So what happens when you are reducing the tooth excessively? It leads to thermal hypersensitivity, then pulpal inflammation and necrosis, and loss of retention and resistance form. So next is your retention and your resistance form. So retention and resistance form is nothing but you're preparing your tooth in a geometric configuration so that the path of insertion and removal of your crown will be in the same path along the long axis of that particular tooth. So retention prevents the removal along the path of insertion of the long axis, and your resistance, it prevents the dislodgement in the horizontal way. So when you know that mastigation, the different kinds of forces that are found on the occlusal surface of the tooth, they are not only directed along the long axis of the tooth, but there are also horizontal or oblique forces when you are doing the process of mastigation. So resistance form prevents the dislodgement of the crown because of the oblique forces, as you see in the picture. So picture A shows you the retention form and picture B shows you the resistance forms. So resistance and retention are both interrelated and they are inseparable, and both of them definitely play an important role in the success of your restoration. So retention is an essential element of two opposing vertical surfaces. So retention is something to do more with that of the axial preparation. So the axial walls of the prepared tooth surface, that is either your buccal wall or the lingual wall of a full veneer crown, they must be parallel and they should not have any undercuts and any kind of notches, and it should be parallel to that of the inferior surface of the crown, so that your crown will be seated on the restoration in one path, and in the same path it can be removed without any kind of a different kind of force leading to fracture of the abutment tooth. So the opposing surfaces that are present, that is the internal walls, they must all be parallel. In case if suppose you are doing inlay or a onlay, the same thing applies. So the walls of the prepared tooth structure and the walls of the restoration should be parallel. So you see in this picture, so in picture A and B on the top, you see how the crown has to have parallel walls with that of the crown, right? And even when it is to apply for the inlay or an onlay, the walls of the prepared tooth structure must be parallel and have the same kind of a surface area like that of the restoration that it is going to receive. So for your retention and resistance form, there are different factors that are important. Your taper, the freedom of displacement. So taper is for your anterior teeth, you should, for all your anterior and posterior teeth, it should be a 6-degree taper that you need to follow, and it should not be less or more than that, so that there will be a single path of resistance, single path of insertion and removal of the crown, and the freedom of displacement. So at the same time, the crown should not be free in the movement, meaning in the oblique, in the horizontal way, and the length of the crown, the length of the prepared tooth structure also should not be compromised, because the lesser the length, it is reducing the surface area, and hence the retention form is also compromised. In certain cases where there are molars, when you are preparing molar teeth, sometimes what happens is they might be submerged, or the height, the occlusal cervical length might be very less in certain molars. So typically when you are examining the tooth itself, you see that the height of the tooth is very less. So in such kind of cases where retention can be compromised, what you need to do is you have to substitute it with internal features. That is, you can prepare proximal boxes or proximal groups, so that there will be an increase in the surface area of the restoration, and hence it not only provides excess surface area, but it also helps in preventing the crown from torquing, that is in oblique forces or horizontal forces, right? And having a single path of insertion is the prime important factor for having good retention and form. And next, coming to your taper. So you have to ensure that the preparation that you have done should have enough taper, right? So your preparation should be more like a converging way, and it should not diverge. So taper is more of importance, especially when you are doing a multiple unit bridge. So let's say that you are doing a 3 unit fixed partial denture processes. So when you're trying to do a 3 unit bridge, you are preparing 2 abutment teeth or more than 2 abutment teeth that are adjacent to the edentulous space. So on either side of the edentulous space, your prepared tooth or the abutments have to be prepared in such a way that they should have parallelism between the axial walls, and both of them should have the same kind of a taper. They should be parallel, and this helps in greater retention, and it should not be over tapered. So when you try to over taper it, what happens is you're compromising on retention, and your crown might not be seated on it completely. Sometimes it might also come out of the the abutment tooth. The cement will lose its properties. So what happens technically when the taper is increased? So at one point, that is near your cervical area, the amount of contact between your tooth and your internal surface of the crown is less. Whereas towards the incisal edge or the occlusal surface, if you have prepared more and if it is more tapering, what happens? The gap between the prepared tooth structure and the internal surface is more. So that means to say the amount of thickness of the cement that you are going to line the internal surface of the restoration is not uniform. So this leads to mini cracks of the cement interface, and once the cement has been fractured, your restoration will definitely be a failure. So the patient will come back to you and say that the restoration that you have cemented has been dislodged. So that is why you need to understand that there should be a uniform taper. It should not be over tapered, because it will also compromise on the retention, hence leading to dislodging of the crown. So that is how you have to. So when you look at your preparation, what you need to do is you have to visualize the taper from the occlusal surface or the incisal surface, I mean. Yeah, so when you look at it, you have to see that there is the taper is very clear, and there are no undercuts. And when you're looking at it from a labial view or from a buccal view, you have to ensure that there is a 3-degree inclination on both the sides, on proximal sides. So the total taper that you need to see is a 6-degree taper. So there should be equal taper on either side. And when you are tapering these axial walls and you allow a slight inclination of the axial walls, you're permitting the restoration to be seated easily and also be taken out without any difficulty. So when the walls are tapered, what you will be able to see is that you will be able to see the entire prepared surface. You can see whether there is any undercuts. You have to make sure that there will not be any undercuts, and in case if there are any slight inaccuracies, then it will be compensated for, and also it helps in permitting the complete seating of the restoration when you are going to cement it. And next is your retention and resistance form. So as a part of your retention and resistance form, I've already discussed about what is retention. So as you see in the picture, so the occlusal gingival length, which I had mentioned earlier in picture A and picture B, if you notice that, as I told you, so the greater the surface area, the greater is its retention. So preparations on larger tooth are more retentive than your smaller tooth. So let's say one is a premolar and one is the molar. So what happens is that in case if it's a premolar and you have good amount of tooth surface, then it will be a good retentive restoration. But whereas if it is a molar, the retention is already compromised, and you see that the height of the tooth is very less. So this is where you will have to take a call. You have to give additional substitute factors to substitute the retention. So you prepare additional retentive notches, or proximal boxes, proximal undercuts, so that it enhances the retention form by increasing the surface area. So, and it also helps in mechanical interlocking between the inner surface of the restoration and also the axial walls of the preparation. So when, even if there are any oblique forces, your restoration will not dislodge, but it will stay in the right place. And as the surface area can be increased by adding the boxes and grooves, that is the only way of doing it. If not, what will happen is your restoration will tend to, what you can do also is you can make a small notch on the occlusal surface. Suppose if you are doing something like a restoration on an endodontically prepared tooth, so you don't have to worry about the exposure to the pulp. So you can make a small notch or a retention groove on the occlusal surface. So the same is replicated in the crown, so that helps in additional retention. So you have to make sure that your restorations, you don't tend to over prepare the occlusal surface. And also, in case if the tooth is already short, and if there is very less length, so what you have to do is you have to increase the surface area by giving additional and grooves. So the next thing is also that it limits the path of withdrawal. The long axis, that is, by having parallel axial walls, you are improving the retention. Then the other things that you'll have to remember is that if you're having a short and an over prepared restoration, prepared tooth, then the restoration is easy to remove and also less retention. So limiting the freedom of displacement from torquing or twisting forces in a horizontal plane, that gives you additional resistance form, and by adding boxes and grooves, you are increasing the retention form. So the path, next is your path of insertion. So when you are, how do you know that there is a single path of insertion and removal of your restoration? When you're preparing, so as you are still in your practice stages, so when you're looking at your typhodont, what you need to see is that you need to close one of your eye and you have to observe it with a single eye from the occlusal or the incisal surface of the tooth. So when you look at that prepared tooth from a distance, what you have to see is that the finish line has to be visible, and the width of the finish line should be uniform. Then when you notice that the width of the finish line is uniform and your finish line is very clear, then you understand that the path of insertion will be easy for your crown to go and be seated upon the prepared. Next is your structural durability. So structural durability is the most important thing that you have to know. So once a tooth has been subject to endodontic treatment, what happens is, when in an attempt to clear up the pulp chamber, to remove the caries, the lesion that might be active, or it might be an arrested caries, when you are trying to remove, you are losing on a lot of core structure that is present in the pulp chamber area, or in the as a lot of enamel and dentin is lost. So what does this do? It weakens the tooth structure, and you know that once a tooth has been subject to endodontic procedure, to find the canals, you are going to remove the major bulk in the core, or the core of the tooth structure is gone. right? So it is just a hollow surface that is present, and it's only the four axial walls that are present, right? So this is already weakening your tooth structure. It has to be restored with a good bulk of material, like a permanent restorative material, something like either a composite restoration, or you can either use your glass ionomer cements, or a hybrid glass ionomer cement as well, and make sure that the bulk or the core of the tooth has been restored properly. And in an attempt to restore this, you must also ensure that this restoration must be able to withstand the forces of occlusion. Okay, and the bulk that you are going to prepare, it must be confined within the tooth preparation. So what happens if you are over preparing the axial surface or the outside tooth structure? You're losing on more of the enamel, and you don't want your crown to be seated on a restorative material. You know what is the difference? You know that enamel is the hardest structure, and try to compare the differences between your enamel and a composite or a GIC restoration. Definitely you are, I think, very well aware that your enamel is the strongest, and it can never be equivalent to that of a restorative material. So what happens is, the more you're trying to remove the enamel, the more of tooth structure that you're losing on, it is making your restoration or your abutment to lose its strength. So there's more of restorative material and less of enamel. So your enamel becomes very thin and fragile, and it's subject to more forces. So this leads to excessive occlusal forces, and it might also lead to fracture of the prepared abutment tooth. So that is why you have to be very careful, and you need to understand that structural durability is very important. So only if you take care of the core structure, and you prepare very less tooth structure on the axial surface, that is when you will be able to give a successful crown. So as you see in this picture, you can see that there are different forces that will be present. So as you are removing the occlusal surface, always follow the contour of the existing tooth. You have to follow the anatomy of the existing tooth, and as you see on the buccal surface also, there is an additional retention form, that is your proximal box, that is created for excess retention to increase the surface area. And also they have done a very clean and clear planar reduction. So the axial walls are prepared along the surface of the tooth, and if you observe the occlusal reduction, it is done in the different planes. So there is a distal slope, mesial slope, there is a buccal slope and a palatal slope, or a lingual slope. So these planes or these surfaces are prepared according to the existing anatomy of the tooth. And next thing is that which is important is your functional cusp bevel. So you know that the tooth, there are functional cusps and non-functional cusps. Upper buccal and lower lingual are the functional cusps, and you need to understand that when these tooth structures are prepared, these are the the lower buccal ones are the ones which are subject to more occlusal forces, because when the upper palatal cusp is going to come in contact with the lower buccal cusp, right? So to dissipate the forces on these cusps, what you do is you prepare a bevel, you give a bevel on the prepared tooth structure, so that you are increasing the surface area, and this is the point where there is stress concentration, and it might lead to fracture of the abutment tooth under the tooth. And also, if you over build up this area with a lot of ceramic, what happens is there is chances of ceramic being chipped off. So that is the reason why you need to give a functional cusp bevel, so that there is increased surface area, and hence also you're trying to dissipate or direct the occlusal forces in different direction. And of course your action is a part of your structural durability. So if you look at this picture, what do you observe? The first part says it is inadequate preparation, and the second part it says that it is adequate preparation. So there should be equal and uniform space around your entire tooth structure, so that the space between the interface between the crown and your prepared tooth surface is uniform, and the thickness of the cement will be also uniform. So if let's say that assume that you're going to cement this crown, the picture A. So when there is inadequate space and inadequate preparation, what happens? The thickness of the cement, luting cement, will be different in different areas, leading to the excessive forces in certain areas where the cement is very fragile and very thin, and where it is thick, the forces will be different. So that is why you have to be cautious about it. And whereas if you look at the second picture, you see that there is adequate amount of preparation, and also you see a functional cusp bevel. So you not only give adequate clearance for making the restorative material, but there is also a uniform amount of space for the luting cement. So in these two pictures, you can also make out that the thickness of ceramic that is being built up, or for the crown to be built up in this area, is uniform, whereas in the first picture it is not uniform. So when it is not uniform, there will be excessive occlusal forces in one area, and whereas in the other areas it will be less. So that is why you have to be cautious. If you are doing a full metal crown, the amount of clearance that is required is 1.5 mm for a functional cusp and 1 mm for a non-functional cusp. And if you are doing a metal ceramic crown, it is 1.5 to 2 mm functional cusp and 1.0 to 1.5 mm for a non-functional cusp. Whereas in an all ceramic crown, 2 mm of clearance is required over all the surfaces, so that it can have enough thickness of the restorative material. So how do you might ask me, how do you measure whether if it is 1.5 mm or 1 mm? How do you evaluate it? In a clinical point of view, I would say that if you have a great idea about the different kinds of tooth preparation burrs that you have, each burr has a different diameter. So if you are choosy, and if you're cautious enough to choose which kind of burrs you are going to use, then definitely you will have an idea what is the thickness. So when you are trying to purchase any kind of tooth preparation burrs, you need to see the manual and see and evaluate which burr is what thickness. So that is how you know the diameter or the width of each burr. And if you are unable to make a choice like that, the only way of doing it is that you need to understand that the burr, the diameter of the burr itself is in such a way that it provides a 2 mm clearance. So once you have done your preparation and you want to check if there is adequate clearance or not, what you can do is that you can just place your burr between the two occlusal surfaces and check for adequate clearance. And if you're able to pass through your probe or your burr between the two interfaces without having a catch, that means to say that there is adequate clearance. And always try to remember that when you're preparing the tooth structure, please leave an additional of at least like 0.5 mm of gap, so that when you're preparing with your fine polishing burrs, still there is amount of tooth structure that is lost. So you must leave some amount of tooth structure. So when you're doing the finishing, it removes some, it shaves off some amount of tooth structure, and that can be compensated so that you don't end up over preparing your tooth structure, and that gives you a better retention, structural durability. So next, coming to your occlusal reduction. So occlusal reduction, as you see in the picture, there's a correct way and there's an incorrect way. So what is correct and what is incorrect? Making a flat occlusal surface. That means to say that taking a tapered fissure burr or a cylindrical burr and just making the occlusal surface flat. As I mentioned earlier, you have to form. It is an anatomical preparation that you will have to do. If you see in picture A, that the preparation that was done on the tooth is following the anatomy of the existing tooth. If your tooth is already having a poor anatomy, if it is having a flat occlusal surface, the restoration that was done was flat. So in that case, how do you handle it? So when you're diagnosing and looking at the patient when he has walked into the OPD, so you need to observe the anatomy of the tooth. If required, you will have to build up that tooth structure so that your preparation will also follow the anatomy and you will have an anatomical preparation. So only if you will be able to do an anatomical preparation, your crown will restore the proper existing anatomy, and it will not just have a flat occlusal surface. The whole idea of preparing a tooth and giving it a crown is that you not only restore the anatomy, the form, but also be able to give the function, so that when you are restoring the cusp, it should follow the occlusal pattern which the patient was having previously. So it has to be duplicated, and a flat occlusal surface will over reduce the height and lead compromise in the retention form of the crown. So if you see in this picture, if you have not removed adequate occlusal tooth structure, what happens? It makes the restoration weaker. Next, it will not provide adequate space for the crown to be restored. There is no adequate space for build-up of ceramic. Then it will not be able to provide space for good functional morphology under the anatomical groups. And also, while you are trying to do the finishing procedures, once your crown has been completed and you make it and you're trying to do the finishing and polishing, it might wear off. So a flat surface will be worn out very easily, and it can easily be perforated. So once the enamel will chip off, your metal under the enamel can be exposed, or otherwise if it is a all ceramic crown, what happens is it can lead to fracture of the So as you see in the picture, your functional cusp bevel is most important for you, and as a part of your preparation, you must provide a functional cusp bevel, and so that it provides adequate bulk for the metal in that particular area and avoiding heavy occlusal contact. So as you have seen in this picture, so if there is no functional cusp bevel, so what will you be doing? What are the different kinds of problems that might be caused? It will cause a thin area, hence leading to perforation, and it might result in over contouring, so excessive ceramic also, and poor occlusion. Then over inclination of the buccal surface, it will destroy excessive tooth structure, so reducing the. So this is how your tooth structure should look like when you're looking at it from an incisal view. So axial reduction. So your axial walls are all parallel, and you can see that the thickness of the finish line, the width of the finish line is uniform. So you know that there is adequate space and adequate thickness of the restorative material, and so when you are not removing enough amount of tooth structure, what will happen is when there are thin walls, it will be subject to distortion, and it also results in over contouring of the axial walls. Hence it might lead to compromised retention, and also it could lead to periodontial problems. Next, coming to your structural durability, also you should ensure that there is adequate thickness of your restorative materials. So to increase the structural durability of your restorative material, what can be done is you can either prepare an offset, you can give an occlusal shoulder and isthmus, or either a proximal groove or a proximal box. So hence you are increasing the surface area and improving the durability of your crown, because the more the surface area, the more the surface area of the crown as well. And also all these additional factors that you are going to involve in your preparation. I hope that you are familiar with all of these terms in your preclinical conservative. So when you are looking at this, what happens is that you are enhancing the surface area and hence increasing the retention. So maintaining the marginal integrity is your next character that you have to be very cautious about. So the demarcation between your prepared tooth structure and your unprepared tooth structure is very important. That is your finish line. So the margins of the restoration, they must be closely adapted to the finish line preparation. So only if you are able to have uniform thickness of the finish line or uniform width of the finish line, then you will be able to demarcate the same in your die. So what happens is that in that phase, you will see that when you are clear where your finish line is ending and where is your finish line located, the wax pattern that you are going to make and the metal that you are going to cast and you are going to build ceramic on that, it should be clearly be seated on the finish line. So that is how you are not allowing any entry of water, or you're sealing this margin. By sealing up this margin, you're preventing any kind of a bacterial invasion and also loss of strength of the luting cement that you are going to use. So hence marginal integrity is very important, and you have to understand the configuration of finish lines that is to be given for different restorations, and the shape of the restorative material in that margin. So when you know that your the margin of the crown and the finish line are having a smooth a contact, and there is not a ledge that is present over there, so that is when you know that the marginal integrity maintain. So that is why you need to have well defined margins, and your margin should be continuous, it should be even and smooth without any notch or any catch. It should be located at the appropriate level, meaning it should not be based on the kind of restoration that you are going to give, whether it is going to be anterior restoration or a posterior restoration. You have to decide the supragingival finish line or equigingival finish line or subgingival finish line. Always follow the contour of the marginal gingiva. So hence you are preventing you are also preserving the periodontium, and also break contact with the adjacent tooth. So if you notice in this picture that your finish line is not, your tooth is not contacting with the adjacent tooth. The contact between the adjacent tooth has to be broken. There should not be any kind of a ledge present in this proximal surface, so that the contact of the original tooth can be restored, and you can have a normal tooth that is like your previous tooth you can restore. So that is why contact has to be broken. So next, coming to your finish line. So as you all know that I told you, the first thing is that the kind of finish line that you're going to give, whether if it is a supragingival or a subgingival or equigingival, this is based on where you are going to place the finish line, right? And what is the type of finish line that you are going to use is the first one. A, it shows your chamfer finish line, and B is your heavy chamfer finish line, and C is your shoulder, it's a 45-degree angle finish line, then a radial shoulder, because they have found that in shoulder finish lines there is stress concentration and there are more chances of breakdown of restoration, so they improved it with radial shoulder. And the next one is your shoulder with bevel. So when you're beveling your shoulder finish line, you are improving the surface area and directing the forces in a different way. And next one is your knife edge finish line. So in which area what you're going to apply is again going to be discussed at a deeper level in your next lecture. So these are the different finish lines. So you must be able to know what are the different names of the finish lines, the configuration. So you if you are asked what kind of a finish line, what is the classification of finish lines, you must be able to write that based on the position where the finish line is going to be located. It is either subgingival, supragingival or equigingival, and based on the type of finish line and the configuration of finish line, you have the 6, that is your chamfer, heavy chamfer, shoulder, radial shoulder, shoulder with bevel and knife edge finish line. So the first one is your chamfer finish line. So briefly, you need to understand that for metal restorations it is a different finish line. For all ceramic restorations it's a different finish line. For porcelain fused metals it's a different finish line. And chamfer is supposed to be the most preferred finish line, and it is usually given in a metal restoration, and because it exhibits a less stress to the underlying cement, and it can be prepared with a torpedo diamond burr or a round and tapered burr. So because it is a more conservative type when compared to a shoulder finish line, whereas in a shoulder finish line what happens is there is increased stress concentration. So this is your shoulder finish line. So it is recommended for only your all ceramic restorations, and this finish line, it has resistance to occlusal forces, and it minimizes the stress and that in certain areas, but because of the angulation that is present at the tooth and the finish line, the axial wall and the finish line interface, as you see in the picture, there is a straight line angle. So in that area there is increase in the stress concentration. This might also lead to porcelain fracture, but the advantages is that it provides adequate bulk of the material at that margin. So hence the translucency is handled and it looks more aesthetic when you're preparing it with a shoulder finish line. But the thing is, you are also compromising on the biological aspects, that is preparing more tooth structure, that is you are sacrificing a lot of enamel to give a shoulder finish line. So this 90-degree line angle which creates a stress in the coronal structure, it can be handled by using modification of the shoulder, that is your radial shoulder. That is you use a rounded internal angle, and then also we can do what by giving a bevel for this shoulder finish line. So then the stress that is concentrated in this area is directed on all these internal surfaces, and hence preparing the preparing the tooth structure to receive the forces, and it will not lead to fracture of the restorative material. So if you look at this the features, the next one is your preservation of the periodontium. So preservation of your periodontium, it depends on the type of finish line, the location of the finish line. If you are giving a supragingival finish line and an equigingival finish line, then it is fine, because you are not invading into the space of the periodontium, but you are locating your finish line at the level of the gingiva or much more higher than the level of the gingiva. So what happens is you are not invading the gingival sulcus area, where there might be invasion of bacteria, and hence leading to loss of periodontium, and it might lead to mobility of the tooth, and hence failure of the abutment. So in these cases what you need to understand is based on the entire periodontal health of the patient and the abutment health. You evaluate the abutment, you examine the abutment, whether the abutment needs any kind of a periodontal treatment, what is the anatomy of the abutment, does it have any restorative material, or if it is subjected to any malocclusal forces. So all of these things have to be taken into consideration, and that is when you decide, when you know that the tooth is sound, that's when you need to decide that you can give it an equigingival or a supragingival finish line. But in cases where you want to, especially in the anterior tooth structures, when you want your restoration to look more aesthetic, what you tend to do is give it a subgingival finish line. So hence it looks more like as if your restoration or your crown is emerging from the gingival sulcus, and it makes it look more like a natural tooth. So, but at the same time, you must ensure that you're not going too deep, because you might end up compromising on the periodontal support, and you might damage the biological width of the tooth, and it might compromise on the periodontium. So that is why in those areas you try and see that you prepare the margins are very smooth as possible, and the patient has to be instructed about the hygiene purposes, use interdental brushes and flossing. The contact points have to be broken down, so that any kind of a plaque that is accumulated can be removed, and it has to be taken care of by the clinician also regularly. And also you need to duplicate your impression and ensure that once the crown has been fabricated on the actual die model, it has to be checked with the duplicated stone model, and make sure that the marginal integrity is maintained. So only if the marginal integrity is maintained, then your tooth structure is prepared. And also we should try that. Certain times you might see that your tooth might be having any restorative material. So if there is any restorative material, what happens is that we might end up placing a finish line on the restorative material. But you need to understand that there is a difference between your restorative material and your enamel, right? Your cement material is more subject to forces, and whereas your enamel is much more stronger. So you need to ensure that your finish line is placed on the enamel itself. Okay, and also try and keep a supragingival finish line, especially in your posteriors where aesthetics is not of prime concern. You can place a supragingival finish line. And so once you have placed your margin, at the equigingival level, so that is where you can ensure that there is structural durability. Then you are preserving the periodontial, preserving the periodontium, and you're not invading into the biological width or the gingival sulcus area, so that the tooth is not compromised on its on the loss of periodontium. So hence you have to take care where the margin is being placed. So it should be placed on the enamel, it should not be placed on the restorative material, and definitely supragingival finish line is much better than your subgingival finish line. And the indications for your subgingival margins is that when there is already an existing carious lesion and you are going to restore it. And the next is to increase the retention. Suppose if it is the crown length is very small, so to increase the retention. Then to improve the aesthetics in case of anterior restorations and extension of a previous restoration, you need to indicate for subgingival margins. Or if the tooth is subject to any trauma, so those cases you will have margin subgingivally. But as much as possible, we must try and avoid placing subgingival margins. So that is about your principles of tooth preparation, and briefly this is what I would like to explain. And in my next class I will be continuing more in detail about the different kinds of restorations. If you have any doubts, you can get back to me. Thank you.